So last night we were talking about doing evals and how it's imperative that you do an eval every time your patient comes in before you treat them, and an eval every time your patient is done with the treatment, so you can actually gauge functional gains, because that's the whole point of them coming to see you as a physical therapist, athletic trainer, chiropractor, whatever. So we got into talking about the failed medical model and what you were taught in school and how that pushes you to a diagnosis, and it takes forever and it doesn't make sense and it doesn't get you right into the treatment. Whereas if you were doing an evaluation that focused on root cause, you would ask your 4 questions in the subjective, then you would do your 1-minute total body functional assessment. Even if they're coming in for shoulder pain, you're still going to assess their feet, why that's important. We went into all that stuff. And then how that information comes together and meshes directly with further assessment, which is what we're going to cover on Sunday night on day 3, which is neuromuscular facilitation test, breaking down the physiology of that, the who, why, what, when, and where of how we do those, and how that relates to getting right into the treatment. So last night on the call, we had a PTA who asked, well, I don't do evals because I'm just a PTA. Basically, the PTs do the evals. They hand the patient over to the PTA for their follow-up visits, and they continue with what the PT did. So I said, okay, so now that you know how you guys do evals and how we do evals with the 180 system, what makes more sense? And he said, oh, well, totally the way you do it with 180. And I said, okay, so if you know that the eval that your DPT did didn't get to root cause, didn't solve any of the problems, all it does is attack a diagnosis, which is based on symptoms. So now you're in the symptom modification realm instead of the get to the root cause realm and fix function. How can you as a PTA take their work, their eval, their information that they're giving you, and do anything that's going to positively affect your patient? And he said, I don't know. So this is another great example of the broken medical model. So we as physical therapists are supposed to follow up on the diagnosis that the physician gave them. And the physician, there's absolutely no way the physician got to root cause, because they see him for 5 minutes, ask them where their pain is, and they come up with a diagnosis, or they go do some bogus imaging that has nothing to do with what's going on. So you're getting that from the physician as a PT. So what you should be doing is throwing that out, starting all over, and doing the subjective and the objective assessment that I just talked about. But you're not doing that, which means you're not getting the root cause, which means you're going to be doing symptom modification on the first visit and the second visit and the third visit and the fourth visit. And hopefully they feel better when they leave for about an hour, and then you're back to square one when they come back. So that's why you're doing that. So the PTA, I said, well, here's what you're going to need to do. You take the information that I gave you tonight, try to implement that on your own. Try to at least implement the thought process. And if you can't implement what I was talking about, at least think through what you are doing and see how that makes sense. You're going to figure out it doesn't make sense. So you're wasting your time with this patient. You're wasting your patient's time. So once you figure out how to ask the 4 questions and how that fits with the screen, how to do that total body screen in a minute, what you're looking for, the follow-up questions that you're asking during the screen, because it's not just that you're asking 4 questions and you're done asking questions. You're asking 4 questions that sets the table for you to ask 50 more questions as you're going through the rest of the evaluation and treatment process. So I said, so not only are the PTs screwed because you didn't learn how to get to root cause in school, so you're following this, do this, then do this, then do this, then do this. And if you find this, follow this protocol or follow this treatment strategy per the diagnosis. Okay. So we went into detail and a lot of good conversation back and forth with them about how this is not working. So if you're not steering the patient away from symptom modification, and you yourself as a clinician are not getting away from symptom modification, there's no way that you can be successful getting to the root cause with your patient. So if you call success, patient feels better for an hour after they left, you can be successful doing just about anything. put some ice on it, put some Bengay on it, do some goofy stretches, do some goofy exercises. At some point, you're gonna get lucky and they're gonna feel better for an hour. That doesn't mean you did anything for them. Okay? If your patient leaves PT and they have to put inserts on, or they leave PT with K-tape on, or they leave with PT and they have to put a brace on when they play sports, you did not do anything for them. Okay? The point is to get to the root cause, reverse that, so they not only don't have symptoms, but they also are not using tape, are not using braces, are not using orthotics, are not foam rolling, are not doing all that crap. So they shouldn't be continuing to do symptom modification gimmicks when they leave you just so they can get through whatever they're supposed to get through. And it's impossible to keep them away from those things when you don't have a quality evaluation. Okay, so these are the things that we talked about last night, and what I told the PTA is what PTAs end up doing after they go through the shift or while they're going through the shift is they just start moving away from the conventional medical model with their patients, and their patients figure out, oh, this is better than what I was doing with the doctor that eval'd me. So patients figure things out because they understand when you can explain things to them without using false narratives, and you can demonstrate on them, this is what I'm doing, this is why it's different than the other people that you saw did, and now you tell me what works better for you. And they will always say, this works better. I can do more. I don't have to do goofy things. I don't have to sit out. I don't have to take medication. I canceled surgery. All of those things happen. But the first thing that you have to do is a quality evaluation. Okay, so that's what we talked about last night on day 2. Day 3 is Sunday. We're going to be going over implementation of the treatment. So further assessment into NFTs, how those work on a neuromuscular physiological level, how we're reversing the inhibition on a neuromuscular physiological level. And then that gets us directly into HEP and exercise. So, the people that are there are getting great benefits out of this, and I'm giving them things to work on in the clinic. So they're doing things. The whole point of this is to take a week so I can give you little things to do in the clinic before the next call. So when they come back for the call on Sunday, I'm going to say how'd things go on Friday, thinking through how you were evaluating. And now do you understand that you have to evaluate them before and after every single visit? Because if you're getting to the root cause on visit 1, they should have a different presentation on visit 2. And if you got to the different presentation root cause on 2, then visit 3 is going to be different. So the broken medical model says we do the evaluation on a visit 1, then you schedule 2 to 3 times a week for 6 to 8 weeks, and we do the same thing unless it doesn't work for symptom modification, and then we just throw something else at it differently, so hopefully you feel better then. No thought process, no progression, no root cause. Okay, so glad that those of you that are with us on those, and those of you that aren't, I can't help you. Can't help you if you don't show up. See you later.